Good morning, everyone. I hope you're all staying safe in these difficult times. Today, I'm going to talk to you about a very interesting topic, uh, which is called tummy tuck, or in the scientific parlance, it's called abdominoplasty. It is a subject which will probably be of more interest to women, and I'm going to discuss with you what exactly this procedure is all about. This surgery, abdominoplasty or tummy tuck, is basically meant to correct the changes which take place in a woman's body following pregnancy. Usually, following the pregnancy, there is a lot of stretching of skin, as well as the patients also develop loose muscles. That is, the abdominal muscles become loose, and the lower abdominal skin especially develops stretch marks and starts hanging. Abdominoplasty entails removal of this excess skin and also tightening of the underlying muscles, so that there is improvement in the basic structure of the lower abdomen as well as the muscle weakness. This procedure is usually performed once the family is complete. That means the woman has already completed her pregnancies, and it's only after that that the surgery is done. In an unmarried girl, usually there's not much of loose skin. There could be some excess fat in the lower abdomen, and this can be corrected by liposuction. But if somebody is grossly overweight and then has lost a lot of weight by diet and exercise or by any other surgical means, then also they may be required to undergo a lipectomy to correct the excessive loose skin, or sometimes even an abdominoplasty. But most often when we refer to tummy tuck, it refers to patients who have undergone pregnancies, their family is complete, and then they undergo this surgery to correct the changes which have taken place. So what happens during pregnancy? Basically, the expanding uterus along with the baby, it causes stretching of the overlying abdominal muscles. That is, the abdominal muscles, which are very tight normally, starts getting stretched because of this expanding uterus. And also it results in stretching of the skin overlying the abdominal muscles. So both these result in the abdomen being able to accommodate this big sized uterus which is growing inside with the fetus. But as it happens, the abdominal skin starts losing its elastic fibers. That means because of the stretching of the skin, over a certain point the fibers break, and this results in what are called striae or stretch marks, which are typically seen in women following pregnancy and delivery. Some people do not have much changes in the pregnancy. That means the stretching is not that much, and following the delivery the abdomen almost comes back to its normalcy. Very few women are lucky enough to have this sort of a situation, but in majority of the women, they will usually be left with the residues of this aftermath of the pregnancy. So most of them will find that the muscles are loose. Many of them may still find that there is excess of skin, and of course the stretch marks will obviously be there. So this is more often seen when a patient has had multiple pregnancies rather than somebody who has had only one child. This is also more often seen, the stretching is more, the overhanging skin is more if she has had twins, and sometimes if the baby was very big, or in some conditions where there is excessive fluid in the uterus like hydramnios. In all these conditions where the stretching effect is more, the changes overlying the muscles as well as the skin is also more. In these patients, if we ask them, typically they will say when they're lying down, the abdomen looks flat. But when they stand up, you'll find that the bulge is very prominent, and the stomach, or as we call it as the abdomen, that looks very big. Sometimes it is embarrassingly big for somebody to ask an embarrassing question whether she is pregnant when actually she is not. So this is really something which can damage the self-image of the woman, and many women also go into some type of depression following this. So unfortunately, this condition is very difficult to correct just by diet and exercise. Of course, it's definitely necessary that the patient makes an attempt. So what we usually would advise to make sure is, if they are overweight or if they have gained weight following the pregnancy, they must start doing a diet and exercise program so that their weight comes back to close to their ideal requirement. And also some core exercises to tighten the abdominal muscles will also be helpful. This is important on two counts, because one, this procedure is best done if the weight also has come down to normal, because in that case there will be more loose skin which can be removed. And what does this surgery actually entail? This surgery, as you can see in this picture, involves removal of this amount of skin. Basically, this is the navel area, this is the pubic area. Most of the times this amount of skin is excessive in women. Besides that, this muscle, which should actually be in the center, most of the times it's come to either side, and these two have to be brought together and tightened. So this is typically what an abdominoplasty would entail: removal of that portion of skin between the navel and the pubis, and also tightening of the muscle. And when we pull the skin down and refix it, it will result in a scar in the lower abdomen, which is usually in the panty area, and we will be bringing out the navel through a small opening. This is a pattern which we have used. This is the amount of skin that is usually removed. So this is just a guideline. And as you can see, this is after the surgery. You can see the scar line which is in the panty area, and the navel has been brought out through a new rent or new opening in the abdominal skin. So what we actually do is, if a patient comes for this type of a situation, it's very important for us to know the medical history, whether the patient or the woman who has come is actually completed her family, her pregnancies are over, she's not planning on another child, and she has also achieved her target weight, and she is basically concerned about the loose abdominal skin and muscles. If this is the situation, then we look into the medical history to find out whether she has had any history of thyroid, whether she is a diabetic, whether she is a hypertensive, or any other medical condition. Many times women have very low hemoglobin, which they have never realized, or they found during pregnancy but not taken care of it after that. So we must look into routine blood tests to see whether her hemoglobin and other basic parameters are normal. Besides this, we also like to do an ultrasound of the abdomen to see whether there is any other problem inside the abdomen. Like, for example, some women may have fibroid in the uterus, or some ovarian cyst, or any such condition. If we know that there is such a problem, and if it warrants any surgical correction, then it can be done at the same time. So doing the abdominoplasty and afterwards checking and finding out that some problem is there in the uterus which requires removal, it means that you have to do another surgery. So this can be prevented if we do a check and see if there is any other problem inside. Once that is done, and we find that she is a candidate who is fit for surgery, then we discuss with her how the procedure will be done. Since procedure involves removal of skin, and we want maximum amount of skin to be removed, so during surgery we actually have the patient a little bent. That means the patient is not lying down straight, but we have the head end also elevated, the thighs also elevated during surgery. It's something like this, so that more amount of skin can be removed. And if once that is done, once the patient recovers from surgery and is mobilized, then the patient has to walk a little bent forward, because we have tightened it in that way. So she will take about 10 days or so by the time she is able to walk straight. But during that period, she will be advised to walk a little bent forward to compensate for the excess skin that has been removed. So there are some so basically it's a procedure which is done under general anesthesia, and so before that we do the markings. As I'd shown you what's the amount of skin to be removed, I had showed you how I had marked that in the previous slide. So we do these markings so that we know this is the amount of skin that we are planning to remove. And once these markings are done, the patient is anesthetized. The position is kept in the way I described to you. She will usually need a catheter in place so that we know what the urine output during the surgery. And then the procedure involves removal of this amount of skin. And once this is done, we lift this portion of the skin above, and then we tighten this muscle using some sutures, which is called plication of the rectus sheath. So it is tightening of the muscle. In other words, if this is away from each other, then we bring it together and tighten it so that the entire muscle is very tight and the bulge gets reduced. After that, we will have to bring the skin edges, that is this point and this point, together to suture, and also make a hole over here to bring the navel out. This is in brief how the procedure is done. We also leave a couple of tubes over here after the surgery, which are called drains. The drains are basically meant to get rid of any blood that may collect. The surgery may take maybe 2 to 3 hours, and after surgery the patient is shifted to the recovery. We usually mobilize the patient by evening if the surgery is done in the morning, because we want to make sure that there are no sequelae like deep vein thrombosis or embolism, which can happen if the patient is asked to lie down prolonged in the same position. So the important thing about any of these surgeries is to make sure that the patient is ambulant or mobilized immediately after the surgery. And usually the patient is discharged in 1 day if the patient is comfortable enough. If not, maybe by the 2nd day. And then usually around the 4th or 5th day, we get her back for dressings and drain removal. And by about 7 to 10 days, all the stitches are removed. This is a typical recovery of a patient who is undergoing an abdominoplasty. And they are usually back to routine work in about 4 weeks' time. And if she is a person who is going to be involved in a lot of physical activity like gymming and things like that, we probably advise about 3 months' time before she can go into active gymming. But regular walks and walking and maybe cycling and stuff, static cycle, that could be done by about 6 weeks. I think I would like to show a few pictures to discuss with you how this procedure would actually change the appearance of the abdomen. What you see over here is before the surgery. This is the marking. This is the overhanging skin, or also as we call as a panniculus. This would have been the midline where the muscles should have been, but actually they are far apart. So, and in this patient we have also done a little liposuction of these areas, but predominantly we are looking at the abdominal area. So you can see this is the low scar. This is totally in the panty area. The navel has been repositioned, and in the side view actually you can see the changes better. The bulging abdomen is seen over here, and here you can actually see the bulge has been reduced. There is a little bit of indentation where the navel pulls it in, and the scar is low down. This is another patient. You can see over here that this is the amount of overhanging that was there, and this is again about 10 days after the surgery. The scar is low place. This is a vertically oriented navel, which should be the normal, and you can see the tremendous improvement in the appearance of the individual. And these people really suffer from loss of body image, because of course the happiness of a pregnancy is always there, but the aftermath which it leaves behind, and the fact that you are not able to wear your old dresses, or the comments which people make afterwards, makes it very depressing to many of these individuals. This is another such patient where you can see that there was so much of loose skin, and you can see how the skin has been removed. Or another such patient has had this procedure. And this is what I was telling you. Sometimes the bulge is so big that these people, when they wear any type of dress, it will look as if they are about 6 to 7 months pregnant. And somebody unknowingly might even make such a comment if they don't know the individual, and it becomes very depressing. So you can see that we have been able to correct that after this surgery. Here is another patient. Again, as discussed, this is the amount of skin. This is about 10 days after surgery. This is the scar about 1 year after the surgery, and you can see in the post-op, see the bulge. This is the same patient. You can see how big it is. Here we have also done a little bit of lipo for the buttock area. You can still see, of course, this portion is hidden, masked, but you can see that that has been corrected, and you can see the overall how this patient's body frame is, bulging stomach and then bulging buttock area. And here you can see that the weight balance is very much, there is nothing, no weight distribution in front, nor is it very prominent behind. So this is the extent to which we can actually improve the patient's, the body image by this type of surgery. I hope this talk has given you some details and also some enlightenment about what an abdominoplasty would entail. Thank you so much for joining us on this broadcast.
Doctor, I have a few questions from our regularly raised questions by our patients.
Yes.
Can I go ahead with the doctor?
Yes, you can.
Yes. At what age can the surgery be performed, doctor?
See, in this case, it's not the age. It is whether the family is complete. As I discussed with you, it means that if the patient is married and has had 2 pregnancies and the children, are 2-3 years or whatever, and they have decided that they are not planning another child, then whatever age, suppose it could be 28, it could be 30, it could be 35, depending on when they decide. So this is commonly the situation where the important criteria is that they should not plan a pregnancy after this procedure is done. One, not that she cannot become pregnant. We usually advise because the muscles and everything has been tightened. And second thing is, if she does undergo, then probably the stitches and other things the muscle stitches will also give way, and whatever results we have obtained would also be lost. So we advise that the patient should decide that she is not planning another child, and then she goes with it.
Okay. There's another question. Can it be combined with other surgeries, doctor?
Yeah. Typically, as I explained to you, we would like to see whether there is any other gynec work type of surgery which could be done at the same time. For example, if it's an ovarian cyst or any such thing, or a uterine fibroid. Of course, many of these may be done by laparoscopy, but sometimes instead of doing another procedure separately, if it can be done at the same time, it could be done. Because we are anyway going up to the muscle, it adds another 45 minutes of surgical time to go inside and remove any of these things instead of doing an open surgery. But if you are looking at any other cosmetic surgery that could be done at the same time, typically women come for what is called a mommy makeover, because pregnancy does not affect only the abdomen. Pregnancy produces fat deposits in various parts of the body. And also there are many changes in the breast. So typically when they come for a mommy makeover, they would usually come for, besides abdominoplasty, they might want liposuction of certain areas like what I showed you over here, the typical thing. Or they might want the breast to be tightened if they have started sagging breast, or they may want, if the breast is, it was bigger during pregnancy, but it has undergone involution after the pregnancy, that means the volume has reduced, they might come for an implant, or they might come for any such procedure. So these also can be addressed at the same time.
Okay, doctor. And the final question, will this problem reoccur or come back after the surgery, doctor?
See, most of these changes are occurring due to pregnancy.
Okay.
So since that problem is not there, that means the patient has decided that she is not going to have a pregnancy. So minor changes may take place. That is, it could become a little more looser than what it was after the surgery, but it will never reach the point where it can become so big, or the skin becomes so loose, unless they put on a lot of weight. Supposing after the surgery they put on 15-20 kgs and then they lose weight, again the same problem occurs. But if it is due to pregnancy and the question of pregnancy is not there in this patient, I would say the results are more or less good for a long period of time.
All right. Thank you very much, doctor, for your informative session. Doctor.
Thank you so much. Thank you so much.